an issue. We'll just have to keep an eye on that. Someone shout out if it goes again. So I'll just quickly show you. This was the homepage for the Shape Place where people need to register to access, and it's a straightforward click on that, and it takes you to a online form, and then they should get their username and password to log into the Shape CVD atlas really quickly. So it should take about 5 minutes. So this is what you'll see now that hopefully this works. The 3 main panels. Left-hand panel is just a bit of the information blurb, and it includes some guidance documents that you can download and read, including a sort of user place guide, which gives you a quick run through of everything I've basically talked about today. And it just sort of shows you where you click and what things mean. It's also here that you'll find any latest updates that we've done, so any new data that's gone in. At the moment it's labelled as beta, because we're still sort of in the testing mode, but ideally we will turn that off and actually just launch this and make it available. I know locally I've kind of given it out to a few people just to sort of test it on different systems, so that seems to be going okay. So then the right hand panel is where you can select different site types, and it's also where you'll find information about any indicators that you might have mapped. So it does cover the whole of England. It is set up around the sort of STP level geography. So usually I select the area that I'm interested in first off, and then you'll see it generates a boundary. So I'm in at Humber, Coast and Vale. The main map just works a bit like a Google map, so you can sort of zoom in and out. I can create different boundaries if I want to. So if I'm only interested in one CCG, I can just click on that CCG in the map, or alternatively just tick whichever CCGs I want to see on here. You can also look at local authority, so you can click here and then it will switch to looking at the local authority boundaries that are in there. But you can build up your own sorts of clusters of CCGs, so we found that's been useful for people to look at. In terms of some of the data, so under the Layers tab is where we've got some information and indicators that are available at mainly, most of these are CCG sort of level. So we've got something like population projections. So this will colour in all of England using the CCG boundaries, and then you kind of get this. The right-hand panel now becomes your interpretation panel, and it explains the indicators and the data source and the key. So we've got some information about the demographics. So about population projections. We then also got some data around CVD. So this one is the numbers of atrial fibrillation prevalence, so the percentage that have been diagnosed. It's from the QAF data, and it tells you, so again you get this distribution chart, the higher the value in the darker colours. The orange boundary there just sort of shows you those CCGs that are in that highest 10% of the value. So it's just a way of looking at and finding outliers. So if you zoom in a bit, and you can sort of hover over, and it will tell you, give you the value for that area. So if I hover over there, North Lincolnshire, the percentage is 2.1%, and it also gives you an idea of the change from last year. In this case, there's been an increase to 0.13%, and there's also got the count and denominator values in there if you needed those. A green label is basically indicating that there's been a fall in that prevalence over since the last period. So in this case, it's only a two-year period, so 16-17 and then 17-18. So we have a few of those. So that was atrial fibrillation. We have preventable deaths. We have CVD under 75 mortality and stroke mortality. We've also got some data on the long-term outcomes. So these are admission rates, directly standardized rates of admission. Again, at the whole time, you can kind of get this idea of where are areas in your patch that might be in that highest 10%. We then also have something data around the CVD emissions, and this is where, based on those data packs that we produced, last year now, so we've brought over the data in that. So that includes those the percentage that are estimated to be diagnosed, and then the numbers that are estimated to treat to target, and then again we've looked at this time the lowest 10%. To identify those groups or those areas that might need targeting. And then we have got that data down at GP practice level as well, which I'll show you in a bit. And then there's just some other boundary layers information that might be useful. Sometimes people want to know how it relates to the wards. So I just zoom in here, and you can get a sense of the wards that are in there. And then there's two other things we can do. If you've selected some sites, you can draw buffers around the sites, and I can show you why that might be useful in a minute. So I'll just click now to just show you those sites. So in Shape, we've got all GP practices and all pharmacies loaded. So if you needed a quick list of what GP practices in the region, so this is now, I'm in two CCGs at the moment, and if I scroll down here, you can see all the GP practices that are across there. If I hit this button, that will export that site list as an Excel file, and that can be useful because when we start to look at these compared to some other data sets that we've got, you can actually kind of generate these sort of mini reports, and it will tell you about the values for these GP practices. So once they're on, we can draw things like the radius, and then we can start to think about what is the population within those. But I'll show you that a bit later. So there's the GPs. We've also brought over all healthcare pharmacies. You'll see these numbers. So that 18 basically just means there are 18 sites really close together. So you can zoom into your map. That too means, as you can see, they were just really, they're probably in the same location, so that you've got a pharmacy and a GP practice there. If I hover over there, that tells me that it's Walkergate. Here is a Boots pharmacy. A 2 seems to show that there are 2 pharmacies in that location. So that's what that sort of number means, and it's just a way for us to manage the visualization. As you can see, it starts to build up, that the numbers in there will increase. I'll just zoom out. So yeah, you can turn them on and off as you need to. So I'll just show you some of then the indicators we've got. So we've got some information, sort of population density, deprivation, ethnicity, the age profile. This data is just the ones that come from the mid-year population estimates, but we have reconfigured them so that they match age bands that are useful in CVD world, be it that they match the health checks population, or are generally related to some of the outcomes that we want to achieve for CVD. So explaining those, I'll just that kind of light grey bar represents all values. In England, I'm in at a CCG at the moment, so it's telling me about those values for those 2 CCGs combined, and in this case it's saying that the estimated population for age 40 to 74 is 44%. So that little bar is sort of the info panel. if I click this button on the end, which is show internal indicator and map, it will go away and then colour in each of the lower super output areas that we have in the boundary that I've selected, which is the 2 CCGs. And so then we can get a sense of the population that are living there. It comes with a distribution chart, and each of those is the LOSA. We've put the data into the quintiles, and that's the key, as well as the numerator and denominator. Sort of one of the original purposes of Things What's Shape is about, have we got the right service in the right location given the needs and demands of our communities? So that's the idea really, about bringing together the locations of services and healthcare assets with the needs and demands of our populations. And again, if I sort of hover over that, it tells me that LOSA's the number that are aged 40 to 74. To remove it, you can just sort of click on that map again. IMD is obviously another important one. So this is the IMD again for each LOSA data we're mapping. Hopefully you're familiar with LOSAs, but basically they're a geography that's derived out of the census, and every one of these sort of little shapes basically will represent an area of about 1,500 population. So someone in, I think ONS creates a sort of an algorithm to turn these into boundaries. So they're quite useful from a public health point of view because they're relatively fixed. It doesn't matter about postcode changes or ward changes. And we can provide a lot of data at that level without it being disclosive because it doesn't require the postcode. And I'll just sort of zoom in maybe a bit more. So you can see Hull, which obviously has a more denser population. The LOSAs are a lot smaller. But again, you can zoom in as you need to, all the way in, to have a look at what's going on in across Hull, which is actually a very small geographical CCG. But as you can see, it works the same sort of way. You get the blurb about the source information, the quintiles, and the distribution. Of note, for this sort of particular patch that we're looking at, you can see that more LOSAs are in that higher quintile of deprivation compared to areas that are not. And so it's starting to tell us something about the needs and the population that we're looking at. If I flick back to the sites tab now, all those sort of GP practices that I've got are still in this list here, but you see now the value for the index of multiplication has popped up too, and this and I can order that. So if I wanted to identify those practices that are in areas with high deprivation, I can sort there, and automatically I can quickly see which are the sites that are in areas of high deprivation. Now, this deprivation is based on the geographical deprivation, the LOSA, rather than a score of deprivation that could have been generated for the GP. So it's about where the GP is located, that particular area that it sits in. So example, that's Leven and Beeford, and that's 4.37. Let's go down. There you see 4.37, the Leven and Beeford there. But again, this is what I mentioned earlier about you can export that to an Excel list, so you can quickly generate a list of GPs that are in areas of high deprivation. We've got a few different deprivation metrics that you can look at. We've also got some QOF prevalence data. So we've got the atrial fibrillation, hypertension. Instead of mapping the LOSA this time, this will actually colour in the actual GP practice, again using those quintiles. So you can kind of get a sense of where you've got higher or lower areas, and that was prevalence. Sorry. As mentioned, we also have been looking at the CVD ambitions at GP practice level. So the same data that was available at the CCG level in layers can also be interrogated here. Again, that distribution is all values in England, and the magenta are all the GP practices values within these two patches that I've selected, and we can already see there's a couple of outliers there. If I click that shows an internal indicator, it will show all those GPs. This is the key. I hover over there. That's Eastgate Medical Group. 66.3% of people are estimated to have hypertension that have a diagnosis. Linked to that ambitions work, it's saying that there are 600 extra people that need to be diagnosed to meet that diagnosis rate or that ambition of 80%. You'll notice it comes with a little, some of them have come with an exclamation mark, and this is basically just telling us about those GP practices that fall in that lower quintile. And again, if I pop back to sites, what I can do is say, actually, I'm only interested in these outliers, so I'm going to tick this box, and then it will only show, that map will only show me those GP practices that have particularly low values on people that have hypertension have been diagnosed. And again, using my search criteria, I can just order those, and then I could export that, and that's telling they are the values for those GP practices. So again, it's just about helping us target. And the next thing, so if we identified that these were the sites we were interested in, these are the ones with low values, again, we could go back to looking at IMD and saying, are these the areas that are also in areas of high deprivation? Should these be the GPs that we target and talk to about their CVD? So to get back, if following where I'm clicking, just untick that box and tick the all, and then they're all the GPs will pop back up again. And then I click on there and it will remove that indicator, and I go back to just seeing that normal sort of green value. So this is just pick another one for you to see, the estimated atrial fibrillation diagnosis gap. Again, this is data that's taken out from those packs that we produced. And as you can see, it sort of works, just looks the same. This time we have a few more practices that are in that lower, sorry, in this case it's the upper quintile. So then we can target and think about how do we find those, tick that box. So I've got a wider spread now. They're across in both CCGs as well. Just turn that off. So the other element, what we can do is think about, well, what does the GP practice look like? So say we had identified this GP practice as having a particular been in a lower quintile for our diagnosis, or it's high in our gap and we want to target it, and we do have a little bit more information about that GP practice. If you click on it, you see now it's got a little orange boundary. It tells me who the practice is, and we can start to look at the population who are within that GP. So if I click there, I can sort of find out where those people live who are registered to that practice. It also, that little dotted line shows it has a branch out here, so there are actually two practices, sorry, one practice but two sites, and there are 1,335 people from this LOSA are registered to these practice. One person all the way out here is registered. And actually you can do combinations of areas. So I've just been at a meeting this morning with the primary care networks in one of our ICSs, and they're going to be using this to try and think about the primary care component, and they want to have an understanding of, say these GPs here were part of a neighbourhood or a cluster, that they'll be able to go into shape and select these and do a joint catchment, and they'll get a full idea of where patients who are registered to those practices all live. And then once you've got that sort of sense of where they're all living, you can go back and look at that other data that we've got, so you can understand their deprivation, you can understand their CVD outcomes, and other data that we've got that's actually back in the SHAPE original place. SHAPE place, you can map hospital admissions, for example. So that's why we thought it was useful to link these two tools together. So you can do what you need to find out about CVD, but then you can always go back to the SHAPE place and look at other data that we've got in there. So you just turn that off, click those buttons, and that will turn it back off again. And again, if we're interested in targeting, I think before we had said that they had, was it 600 patients they still needed to find? Well, this gives us an idea of their total registered population and what sort of age band and distribution they have. So interestingly, they do have the sort of an older demographic in this particular site. And also, it's interesting to know about the workforce. To what extent do they have enough GPs to target? If we're wanting them to think about doing some CVD intervention, in this case, they're saying they have 7 GP headcounts with a 5.1 full-time equivalent. And this also comes with an age breakdown. Particularly, this is used to help identify practices that might have near retirement age type sites that people can use. And this data is all freely available, and that's the source data there. Sites, and that takes me back to that panel. A couple of supporting documents. So if you find you're in the tool and you're not sure of something, or if say you've demoed this to maybe a GP practice or a practice nurse, if anyone kind of gets stuck, we do have a live get help. You can type in there and say, help, how do I do something? And someone will probably get back to you. It's kind of a Monday to Friday 9 till 5 type service, but sometimes we have to close it if no one's in or everyone's gone home. But most of the time that's live and available. But like I say, we do have some inbuilt guidance documents that you can find, which also includes a technical guide about some of the data and indicators that we've used, which is mainly repeats what is in those data packs that we did. And whenever you see this little question mark, that means it's a help icon, and you can click on that and it'll give you a bit more blurb about what you do. I think the most common question we have about SHAPE is about using the information and sort of printing. So that export data will export sort of lists of sites and some of the data. In terms of the maps, I mainly say to people, we'll just use your snipping tool functionality and sort of take your screenshot and do what you like with it, really. We do ask that if people can include the copyright statement, because that just shows that you've got permission to use the maps. But then once you sort of take your screenshot, you can crop it as you need to, and that's probably how I mainly use the outputs from this. Some web browsers have a export to PDF function built in, and if they do, there'll be a little icon here. I'm using Explorer Edge, and it looks like I do have it. So I know Chrome does, but I don't think other earlier versions of Microsoft Explorer have that. But that might be useful if people want to export that data as a PDF and use it in reports and whatnot. In terms of the future and support for using SHAPE, so SHAPE is developed by myself, and we are part of the local knowledge intelligence service. I happen to be located in Yorkshire and Humber, but all LKIS teams across the patch do have a local SHAPE super user, and so they are someone that you can go to for help and support in using SHAPE. if the query is specific to the CVD Atlas, I suggest just to come to me initially. I'm happy to sort of field those requests because I can then deal with any technical shape issues you might be having. But if it's also about the content, maybe it's about an indicator, you're not sure how what it means, I can then pass that on to the NCVIN team if it's something I don't think I can answer from a technical point of view. And I mean technical and in an analytical sense rather than technical as in our software development role. So at that point, I will go to questions.
Thank you very much, Barbara. We have muted everyone, so if you've got any questions, you can press star and 6. And alternatively, if colleagues are not able to get through with the question answers, you can always put them in the bar on the side, and I'll pass them on to Barbara. So Barbara, the question is, Glenda is asking, when would the live tool be available? Because I understand this is actually the beta phase.
Yes. Well, I think I'm just waiting for your sign off, really.
Okay.
And I think we're there. I think it's got stuff that it can start using. We don't have to go out and say this is completely the finished product, because inevitably new developments happen and boundary changes happen that we might want to bring new stuff in as the year goes on. But I think we could sort of sign this off and launch it and just let people go and start playing. And we can describe it as a dynamic tool. You know, we want feedback on it. We want suggestions for either new data or new functionality that we can then start to think about building in next year. So that would be my ideal, if we could just sort of say, yeah, go ahead and use it.
No, that's very helpful. I think my understanding is we would also discuss amongst our CVD team and see when is the best day, and we can launch it accordingly. And it's absolutely great if we can call it a dynamic tool. So the basic idea is that we want all the PHE center leads and all the stakeholders who are actually involved directly with this piece of work, they can have their input. We have another question coming from Catherin, and she's saying, will the CVD page be accessible to all the existing users of Shape, or will we need a different login?
So at the moment, it is accessible to anyone with a Shape credentials. So if you log into Shape here, complete user registration form, that will take you, and then if you put CVD in, that will take you in. So at the moment, it's not closed. It's to every Shape user has access.
That's brilliant. Thank you. Thank you, Barbara. I think there are no questions at the moment. That Glenda is asking another one. Yeah. But in the meantime, I was wondering, Barbara, would you think that it would be helpful if we can go through the STP commitments, how the map looks like?
Oh yeah, I forgot to mention that one, didn't I? We had data that was reported, I think, monthly from centres on which areas are prioritising. So let me just turn off the sites because it's in the way. This was last updated November 18. So we will look to update these for you whenever you have the data, basically. We can upload them whenever you have them. I think that, are they reported quarterly or is it monthly? I don't know.
It's monthly.
Monthly. And one idea we had was that you could potentially attach case studies if you wanted. Mm-hmm. So if this, Lincolnshire East says it's green on hypertension, if you wanted to tell us what particularly has worked well in there, we could attach a little case study that would pop up here. so that you click on it and you could read and get a blurb about what's actually happening in that patch. So that is an offer of some functionality that is available to you as centre leads, but obviously it depends on whether or not you want to fill out that template to that extent, I guess, and if you would find it useful to access it in that way.
That's good, thank you. Any more questions, anyone? I can see Hazel and Glenda, you were typing away, but then it disappeared. And I wondered if colleagues still cannot unmute themselves if they want to talk and pose the questions.
The presenter has allowed participants to unmute themselves.
You're unmuted at the moment, so you can press stars and 6. So Sue is her question. Yeah, and Sue has got a question. Yeah, hello.
Hi, it's Glenda here. I was trying to type, but it wouldn't go through. Apologies in the first place for the background noise. I was just wondering, are there any plans to put any CVD ambitions in around cholesterol?
If we had the data, then yes. But I think with the last, sorry, I heard that we didn't have sufficient data for that. But I will have to check with my NCVN colleagues if that's still the case. But if we had the data, then yes, we would put it in. But I had the feeling we didn't have the data.
I was just wondering, because there is that cough indicator, isn't there, around newly diagnosed diabetics with their cholesterol levels less than 5 millimoles. Is that a possibility?
Yep. If we wanted it in, I think there's no harm from our point of view putting it in. Again, I'll just have to check with our NCVN colleagues that it's a robust indicator.
Okay, thank you.
Yeah. We've got Sue. Her query is, how easy would it be to see the CVD risk compared to the dementia prevalence, Barbara? Do we reckon we can reflect any of that information here?
Diabetes. So let me just double check the. I don't think we've brought over dementia prevalence, have we? Sorry, diabetes prevalence.
Mm-hmm.
No. So what we can do, it will be straightforward. We can bring over the QOF diabetes prevalence. So you're unable to sort of overlap them, but you're allowed to investigate them. So if we did too many indicators overlapping, then everything, rather than being purple to sort of the lighter purple, everything will just be sort of brown. So you could look at them individually. So we could certainly bring over, it was diabetes, wasn't it? No, it was dementia, sorry.
Yeah.
Yeah, so what we'll do, I can bring over dementia prevalence.
Mm-hmm.
In the shape tool, shape place, we do have a few indicators specifically around dementia, actually. So you could always sort of toggle between shape place and the CVD one to have a look. But yeah, we can bring over dementia.
That would be excellent. Simon would like to know if we can look at the NHS Health Check update. I think we did have this indicator, but we didn't go during the demo. But if you'd like to explain a bit, Barbara.
Yep, so this is the cumulative percentage of the eligible population that were offered a health check. Again, you can see in orange the CCGs that are sort of in the lowest 10%. It is a CCG level indicator. Not sure if we've got it at GP practice level yet, so that's why it's only in this at CCG level.
No, it's only at local authority level already. So there is only one value by local authority, so you probably assigned the value of the local authority to the CCG.
Oh, sorry, yes, it does say local authority.
Yeah,
so we don't know that. Yeah,
we don't know we don't have anything under more granular at this stage.
Yeah, so you can see that's the local authority boundary. So we're given the LA value. Yeah.
Hello, could I ask a question?
Yes, go ahead.
Hi, I've had to call into the webinar on a mobile phone, so I haven't been able to see the visuals. So apologies, I'm a little bit in the dark still. I just wondered if there is a specific request of the CVD prevention program managers in the centres to roll this out somehow, whether we're expected to run workshops or anything like that on the tool.
Yeah, so I think we thought it would be it's another tool in your toolbox for when you are going out and engaging, and if GPs are wanting to benchmark and understand their place and their areas, you know, we're anticipating that you could use this when you are out there discussing it. If you got a sense that some areas might benefit from a training session or something like that, then potentially that could be co-organised with your LKIS leads or with the SHAPE team. But essentially we thought it was a tool for you to understand what's going on, to help focus and target. And then when you are out and about, it might just say, well, actually, when you're talking to a group of GPs or a CCG, you say, oh, actually, there is this tool if you wanted to have a look and have a deep dive and have a play yourselves. So it is open for everyone.
Okay, I think just because we are sort of closing our programs and sort of implementing our exit strategies, it might be that we'd need to consider other means of disseminating it. I'm not sure how the other program managers feel, but I think it's probably quite late in the day to be able to bring this into the program that we're currently working on. But I'll have to chat to my LKIS colleagues about how they might be able to disseminate it afterwards.
Yeah, I think that's a valid point. And in a sense, this can be a bit of the legacy of the work that you have done, so that there is something that still is around. But yeah, I would treat, in terms of the support, we just treat it as if it's the SHAPE place work. So, you know, like I say, each LKIS lead should have a super user and already go out and do their demos and whatnot of the SHAPE. So this is just another part of SHAPE, really.
Okay, thank you.
Any other questions? And just to add, those of you who may have missed the webinar in the initial part, it's actually being recorded, so we are going to send it across anyway. And if you've got any questions, let's say they're not coming up right now, you can always send them across either to me or Barbara, and some of them we've already made note of, and we'll get back to you on that. And if there is anything more you'd like to know, we'll add the responses as we go along. And Hazel also mentioned that the STP commitments, they are going to be updated by January, so you'll have a more up-to-date map towards the end of this month. Yeah.
Yeah. Good. Thank you.
Barbara?
So I think this is a.
Can I just ask?
Yes, go ahead, Catherin.
Barbara, you said I'm in SHAPE now, in the SHAPE, big SHAPE. Or do I get into the CVD page? I didn't see when you showed on the.
Yep. So it's a different URL. So it's shapeatlas.net, and instead of place, just type CVD.
I see. Okay, thank you.
And moving forward, I think it will be really helpful if we can see some practical examples, how this, the tool has actually helped in the planning and decision making, because we do understand this is actually a legacy piece of work. We want to leave it in a way with all the center colleagues so that they can use it for the bigger purposes for the CVD prevention work going forward. But if you've got any practical example, however short, however big, that you're able to share, I think it would be excellent to hear, not only for the purpose of reporting tool and also for this work, but also for Barbara in the long run, how this tool can be informed and better and more user-friendly at the same time.
Yes, absolutely. Yeah.
Any other comments, anyone? I can see Simon typing away. Oh, that's actually a thank you note. Barbara, is there anything any practical tips for all the users who would be actually, I think, going back and using it more actively now, just to see?
Yeah. To basically go in and have a play. You can't break it. It's not gonna. It's easy to use once you feel confident, just to click on some buttons and then you can see what it can do. So get in there, have a play. If you're not sure what to do, use the help function and read the user guide, just as a little reminder of the things that can be done. And get in touch with the Shape team. You can email me directly, and there's a Shape help desk as well. All the details are on the info panel. But yeah, we want it to be used, and we will help you use it and give you as much help as you need, really.
Great, that's excellent. Just one practical tip: anybody who would like to know a little bit more. I know the tool seemed very busy, but if you can just have a look at the user guide, it just gives you a snapshot of most of the indicators. So for example, it tells you about the STP commitments and also on the the CVD ambitions, related indicators, and also around the health check. So it will give you a broad idea of what you are going to be looking at, and then you can play with the tool. So that would be really helpful if you can just look at the list. And we've got 11 more minutes. If anybody's got any questions, this is your time, I think. The 24-25 colleagues on the call today, and it has been a very encouraging, very useful time. Thank you for your participation in terms of your questions, answers, and Barbara, especially to you for taking out the time, taking us through the whole presentation and the live demo. And we look forward to more comments, any reflections, any thoughts, and look forward to connecting with you again.
Thank you now.
Thank you.
Bye.